It's Rudy. Alright, today we're going to be talking about low back pain and the reasons why. So, why do you have low back pain? And this will work for mid back pain as well. Similar reasons for upper back pain and neck pain. So, low back pain, why do you have it? It's usually a muscular imbalance. Now, what I mean by imbalance, I don't mean you're falling. Well, some people are, because the back pain is the pillar of life. So you could have really tight hip flexors and really tight hamstrings, especially if you're sitting around, whether your job is to sit around all day, and then you go home, you sit around all day even more in the evening, and they get shortened and tightened. So do these, and your glutes get really weak, and that causes back pain. There's one where you could have a duck butt, where it's like, because these are too tight, and it can cause basically you can pull this or strain this muscle, especially if you're an athlete and these are too tight and these are too stretched out. And the opposite is true as well. You can have really tight hamstrings, and so instead of being pulled this way, your pelvis is being pulled like this. So it gives you that Pink Panther butt where it's like straight and flat. So so basically you have some kind of anterior or posterior pelvic tilt, and neither of those is good. Another could be the inner thigh muscles, the adductors, and even stretching those out, those can give you some relief as well, if not complete relief. And then there's a psoas muscle. It's on the front of the spine, of the L, the lumbar vertebrae, and it goes from these 5 discs to about right there, and it goes all the way down to about right here. So, and it's the only muscle that crisscrosses and your upper and lower body. It's called the psoas. It starts with the P. Psoas major, psoas minor. Just call it psoas. And that gets really tight. That's one of your hip flexor muscles, not just these little muscles up here, and the IT band and the upper quads and stuff. So I'm going to show you something you can do twice a week, just twice a week, and that alleviates your pain, because we should all live a pain-free lifestyle, right? And worldwide, back pain is the leading cause of disability, and it accounts for about 264 million lost work days per year. So, as you know, when your back's messed up, you ain't moving much, and you got to be put back in balance. So in this 3-part video series, right now we're going to talk about a few stretches you can do, which, like I said, in order of importance, this will be the most effective. But the other 2 videos I'm going to put, so it's going to be 3 parts. The second is going to be some exercises you can do to strengthen those, and the third is we're going to talk about diet and your endocrine or hormone system, and nutrients in general, which would help prevent pain. So muscular imbalances, like I said, there's sciatica, which is the big nerve right here, and that controls your lower body mostly. And some people have scoliosis. It's like a crooked spine of some sort, and of course there's bulging discs. Those are other causes of pain, which usually from an acute. It's acute, so it's usually from an injury, the bulging discs, and yeah, I'm gonna show you how to do those. So first up, we're gonna loosen up. We want to loosen up the hip flexors, right? So the easy stretch that everyone knows is obviously this one, and then you try to put it back behind you and try to lean back a little bit. That stretches this, and sometimes I even get a little back crack. When you hear the crack, it's just the tendon stretching. It's not bones crackling. That's a good thing. When you hear the tendon snap, crackle, and pop, it also stretches that. It doesn't just stretch your quads, it stretches your hip flexors, and you might even get a little adjustment in there just from doing that stretch. Depends how tight you are and which muscles are tight. Most back problems, like I said, there's several different reasons why you have back pain. Okay, and then there's the hip flexor, and or what do they call it? Anyways, get into a lunge position, and then go forward. And this is the easier way to do it. Now, if you want a more intense stretch, put your foot further. So now it's kind of like you're doing the split. Yeah, and then you just, do that, stretch out like this. And, at least 30 seconds, and then switch immediately to save time. Do the other leg. And 30 seconds to 90 seconds. And then switch back to that one. So do 2 sets. If you want to do 3, go ahead and do 3. Again, do these twice a week. And another one is going to be you stretch your glutes. So you can lie on the ground and then stretch like that. So you can stretch right down the middle, or to this side, it'll get the outer glutes, or do like this, and it'll get like more of the inner glutes. And of course, if you want to stretch your inner thigh muscles, you can get like a horse stance position and kind of get down like this and push out, or grab your ankles and push out with your elbows. Either way, push out and get nice and low. It'll stretch your inner thigh muscles out. And another one is this. Or if you can get in a splits position like this, if you want. Now another one would be like this. So you have it kind of straight, and then the one behind you can have it bent. You can have it bent. It's good to have cushion under this knee, because if you're not used to hard ground. So you can have it like this. You can have like 290s. Or if you can have it straight, either way, whatever you can do. Try to work for the straight. Now, you can bend down like this. That'll stretch your piriformis. It's the deep glute muscle. It goes from your tailbone out to the hip. But you go like this, and I feel it stretching right here, and it's somewhere in like my back. And try to put this little forward. There you go. And you can push off, or if you have to grab on this stuff, on a table or chairs, and then try to get try to get this one, try to get this to touch the ground. So you kind of want it to you can lean this way if you want, and then go back up, and then try to get it to where it's touching the ground. I also feel the stretch right here. And that stretch is really good for that psoas muscle I told you about, which is on the front of the spine. And it's, it's in our body basically. Yeah. And sometimes mine will just actually, I feel the crack on this side. So I guess some on this side it gets tighter. But I still do the other side, because you want to do both sides. And even if one side's tighter than the other. And let me see, there might be another one. Oh yeah, piriformis stretch directly. You can sit in a chair, an office chair or a couch, or on the ground, pull it up like this. Basically, you want this to go towards your chest. Or if it's easier for you to bend forward, go ahead and bend forward. Yeah, my back just cracked just because, it's the morning. But warming up. And yeah, or you can hold it like this. And that's your piriformis, which is, again, from the tailbone to the hip. It's a deep muscle. And for people that do ballet, whenever they do this, they get that really messed up, because apparently it works that a lot. So, and I worked on a lot of clients, as a massage therapist, and sports massage and deep tissue. Basically, some of them get sciatica, and that's all. It's inflammation on that nerve, and that's the nerve that if it's, severed, you're disabled. So that's really important. And yeah, those are the main stretches I recommend doing, but there's one more, of course. Go ahead and, if you have a chair, or if you're outside, you have a pickup truck or something, or a couch, and then stretch your hamstring out. One at a time. It's the lazy way and the easy way. And I don't recommend doing it like this, both at the same time, because especially in elderly people, they feel the little eroding away over time. It can erode away a little bit. Doing both at the same time, because it causes some friction in your discs. So do one at a time, or you can do, same thing. You can do like that, or whatever, as long as you stretch it one at a time. I recommend putting it on something. It's the easiest way and the fastest way to get these stretched out. Now, again, this is part 1, and thanks for tuning in. I'm Rudy.